Ever experienced a painful click or grind in your jaw when eating or talking? It could be more than just a one-off inconvenience. You might be dealing with something known as temporomandibular disorders, or TMD for short. This condition affects the temporomandibular joint, hence the acronym TMJ, which is the hinge connecting your skull's temporal bone to your mandible or jawbone. It's a vital part of your anatomy that you use countless times a day, every time you talk to, or even just open your mouth. TMD can cause pain and dysfunction in this joint and the muscles that control its movement. It's not just a nuisance, it's a health issue that can significantly impact your quality of life if left unchecked. But don't worry, understanding is the first step to managing it. Now that we've understood what TMD and TMJ are, let's delve into the symptoms. TMD can manifest in many ways, and identifying these symptoms is the first step towards managing them. One of the most common symptoms or painful clicking or grinding sensations in the jaw when opening or closing the mouth. This can sometimes escalate to the jaw locking and open or closed positions. Now imagine talking, chewing, or even just opening your mouth wide to yawn and experiencing pain. That's another hallmark of TMD. It doesn't stop there. The disorder can also trigger painful jaw clenching, headaches, and even neck pain. But what about the ears? Surprisingly, TMD can cause ear-related symptoms as well. These may include ear pain or ringing sound or a feeling of fullness in the ears. Remember, these symptoms may vary from person to person. They may appear individually or in combination. Identifying these symptoms early can greatly help in managing TMD, but how do we manage it? Let's discuss that. Managing TMD doesn't always require medical intervention. There are several self-care steps one can take. Let's dive into some of these, shall we? First, this means reining in those wide yawns, toning down the high notes when singing, and keeping the loud yelling to a minimum. Your jaw will thank you. Next, food choices can make a difference. Opt for soft foods and steer clear of crunchy or hard ones that require more effort to chew. This will help lessen the strain on your jaw. Also try taking smaller bites and avoid prolonged chewing. And sorry, gum lovers, but it's best to give up chewing gum for a while. Lastly, for now, be mindful of harmful habits. Nail biting, cheek biting, or any other habits that put undue stress on your jaw need to be curbed. These are just the start. There are more self-care recommendations to discuss. Continuing from where we left off, let's discuss more ways to manage TMD at home. An essential aspect is maintaining the rest position. Your tongue should rest on the roof of your mouth, teeth slightly apart, lips slightly together, and your jaw relaxed. This simple position can significantly reduce unnecessary strain on the jaw. Equally important is your posture. When sitting or standing, try to raise your sternum and place your shoulders back. This alignment can help alleviate some of the pressure on the jaw joint. At night, support your neck during sleep and avoid sleeping on your stomach. This ensures that your jaw isn't forced into an unnatural position for an extended period. And don't underestimate the benefits of applying moist heat or cold to your jaw muscles. 15 to 20 minutes of this can do wonders for relieving discomfort and promoting relaxation. Remember, these are simple yet powerful ways to manage TMD, but let's not forget the role of stress. Stress can be a major contributor to TMD. Managing it can provide significant relief. It's no secret that stress takes a toll on our bodies, including our jaw muscles. That's why relaxation techniques such as meditation and yoga can be useful tools in managing TMD symptoms. These practices can help you unwind, reduce muscle tension, and most importantly, alleviate jaw discomfort. Gardening is another stress-relieving activity you might consider. It's a gentle way to stay active and keep your mind focused on something other than pain. Similarly, regular walking and abdominal breathing exercises can promote overall health and indirectly aid in TMD relief. Remember, self-care is key in managing TMD. It's all about taking small, conservative, and reversible steps to better jaw health. Avoid extreme jaw movements. Be mindful of your posture, and remember to give your jaw the rest it needs. Remember, if your symptoms persist or worsen, it's always recommended to consult a physician. Take care of your jaw.